Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be giving you an update on some of the patients that have gone through their full course of treatment here at Maragal Medical, including regenerative medicine. And we figured the best way to start is with our own Dr. Mike Marciello. We'll provide you with a lot of great information on this one, so stay tuned. Okay, Dr. Mike, we're about 2 months shy of your major catastrophic event where you broke your ankle, you had a major injury to your left knee as well. You went through a series of treatments here. We did some regenerative injections with the left knee. You went through a course of physical therapy. Thought it would be a great opportunity to talk to the listening audience about the trauma that you went through, the recovery process, and some of the innovative treatment options that we have here at our clinic.
Yeah, it's without question, you never experience a big injury and know what to say to your patients until you've actually gone through it yourself, for sure. So to remind the listeners, last July, the end of the July, I fractured my right ankle and three locations that needed plates and screws to surgically repair it. At the same time, I had ligament injuries to my knee and a tibial plateau fracture on that left knee, which are quite significant considering both legs were involved at the same time.
Yeah.
The regenerative injection for my left knee worked very well. We got it injected quite early. There was essentially resolution of the fracture site. There was no, again, identified damage, and the healing properties were wonderful. Again, of course, the regenerative injections speed up the recovery, and that's what we do here in this clinic, to try to figure out how to make people better, but also to repair things sooner and hopefully get back to recovery. Now that again was on delay because again I couldn't do much for my left knee because I had to recover my right ankle, and that was a long process and still is a long process. And many big injuries, we think about big surgeries, the surgeon may say may take a year or so. You don't think it's going to really take a year, but it does. It really does.
Yeah.
So I'm in this process, still recovering. We're looking at aspects of rehabilitation now beyond just standard PT. It's the hard work of the proprioception, which we call position sense, and recovery of the ligament structures to maintain our balance, to allow us to try to figure out where our body position is. Now the ankle's feeling well. I had to go back and take the screws out because the injury was being restricted with the screw.
Yep.
So that was removed a couple months ago. And again, recovery is now improved further, but still my ankle doesn't know really where it is so well in space when I'm standing on one leg and that kind of thing. So using our Hanova and our balance machine allows that to recover in a better way than just saying, oh, just do some exercises. And again, because there's alternating components when you walk, you move both legs. Right. The knee, I'm doing the same thing, and that's recovering also quite nicely. The process is actually interesting. The discomfort to the ankle, much improved. Recovery is better, gain range of motion. The left knee with ligament injury is what that good old people say, if I only just broke the bone, maybe it wouldn't hurt so badly. Yeah. Well, the ligament is still loose in there. So I occasionally get a little bit of instability in that knee. I feel a little bit of, we call bogginess, or occasionally feeling a swelling if I'm on it too much. And then I still have to work hard in relation to position sense. And that's again what we're doing. We're trying to maintain mobility, we're trying to level the core, we're trying to work the strength above and directly into the spaces where there are problems in order to get back fully and allow me to get back to my running and exercises and things. So it's a long process, but recovery has been really slow and steady and still getting better.
Yeah, and the best part too, here at Maragal Medical, we combine all the disciplines where we have medical care, physical therapy, chiropractic treatment under one roof. But again, as Dr. Marciello said, we're one of the few clinics in the region that specializes in the field of regenerative medicine. So if you or a loved one, or if you know someone that has suffered a major trauma and is just having a lot more difficulty with that recovery process, have them give us a call. We take most insurances.